Here's how to insert a straight catheter and obtain a urine specimen from a male patient. So first you want to grab your catheter, the straight cath kit, and there are sterile gloves in the kit, but you can also get an extra pair of sterile gloves if you need to. So first you want to expose the patient, and obviously wear your gloves, wash your hands before you come in the room, and then you can start setting up your kit. Pull it open. And inside the kit, there are the sterile gloves, there's a few draping pads, the Foley catheter, cleaning swabs for the penis, and lubricant. So I'm gonna put these sterile gloves on. I'm gonna take these ones off. So now my hands are sterile. Keep your hands above your waist at all times. So here's the urine specimen, which I don't need. The drapes. So the first drape is just a regular one with one shiny side and one not shiny side. The shiny side goes down. And so I'm gonna place this underneath the mannequin here, and just make sure you don't touch anything with your sterile hands. These are the sterile gloves that come in the kit. You can use these. I brought my own on the side and want to use those. It's your preference. There's another sterile drape that has a kind of keyhole in it, like that, so that you can just drape over the patient's penis. And just make sure, once again, you're not touching anything on the patient that will break your sterile field. So next, there's the urine specimen cup. So I'm just gonna leave that inside the box and put the cap on the table. And then I'm gonna bring my tray towards the patient. So there's 3 cleansing swabs in here, and then the lubricant. So I'm gonna take the lubricant and put it in the box. If I can open it. And dip the catheter in the lubricant. So that it goes in the patient easier. And so while the catheter's in the lubricant, I'm gonna pick one hand, so I'm choosing my left hand to be my non-sterile hand. So once my hand touches the patient, I can't anything sterile inside of this box now. So this is gonna be my non-dominant hand. So I'm going to grab the patient's penis with this hand and start swabbing. So this goes inside and clean outwards around the penis, and you're going to do this 3 times. And you can just discard these. this way. Next, I'm gonna insert the catheter. So this hand's still sterile. This hand does not drop the penis. If you drop the penis by any means, you have to re-clean it again. So I'm gonna grab the catheter that's dipped in lube, and I usually hold it like this with kind of a loop in it so it's not dangling around and flying around everywhere. And so have the patient take a few deep breaths and then insert the catheter and advance it until urine comes out. Obviously the mannequin, no urine is gonna come out, but we can pretend that urine's coming out. So you can obtain the specimen and then get the rest into the bin. I'm gonna take the specimen cup out, put it on the table. Notice when I turn, I kind of don't turn my entire body away from the sterile field. I just move my hand above waist level around. And then once there's no more urine coming out, you can have the patient breathe a few more times and slowly pull the catheter out and put it in the bin. Now that the catheter's out, nothing needs to be sterile anymore, so you can just clean up everything. I'll usually clean the patient because sometimes lube can get on them. Make sure to put the bed in the lowest position, put the patient in a comfortable position, make sure they have their call bell, their belongings, and that's it. So after you get your urine specimen from the straight cath, you want to make sure that you time, date, and initial the vial, and you want to make sure the patient's sticker or the patient's information is somewhere on it, and then send it to the lab.